Across Ghana, illegal mining activities have left many water bodies destroyed. Thousands of acres of farmlands have been turned into wasteland, but little has been said about the devastating health implications for the communities where these activities are being carried with brute impunity. In the latest Hotline documentary produced by Seth Kwame Boateng, he visited communities where death from poisoning is a new norm. He engages patients, doctors, researchers, and environmentalists for the documentary. And we showed you excerpts of the documentary, shows fully later this evening at 8:30 p.m. We've got a conversation on the back of this. Let's begin with the producer of this documentary, Seth Kwame Boateng, and then we'll come back in the studio. I have Professor Chris Gordon, who is with the Institute for Environment and Sanitation Studies at the University of Ghana, Legon. But first, let's talk to Seth Kwame Boateng, who joins us via Skype. Good morning to you, Seth.
Good morning to Professor Chris Gordon. Because I never told him I was taking an emergency trip elsewhere. So, Prof, if you're listening, I'm sorry for not informing you.
Okay, so Seth, this documentary is on the use of mercury, the effects, of it. First of all, why did you decide on this particular subject? I
had heard of things that mercury relates to health, and I'm particularly happy that that's the video because it first drew my attention and research. So after my research, I went back and this is what I'm learning. What I'm done, and he told me, I said, okay, I'll go into this. And I have also heard a patient from the hospital who are battling a serious disease. Go to the dialysis of the hospital. Almost 90% of who are coming there for kidney problems. Dialysis are the mining business, most of mining areas, and of them come with test state kidneys. That is, they've not both kidneys and they are having your dialysis for the rest of their life. They are every week. And of course,
can you hear?
And so, if these people come there and have poor, how many of them can afford taking this every week? At a distance, some are coming from Accra, and other places. It was costly, and I realized that. And also, they didn't know that that harmful effect is the reason it needed to go into this. And I had also of the manga team to destroy things with their hands. These sites that they destroy have been contaminated. The mercury has contaminated them. And we're touching their bare hands. I went around with some of them. So that they were that was risky. So, Mama, it's not about who are into mining. Those of us the food.
Hello, Seth. It looks like we're struggling to hear you fully, so we're going to reconnect with you, Seth Kwame Boateng, producer of this documentary on the effects of mercury. But let me engage Professor Chris Gordon, who you will later see this evening because you also feature in this documentary. First of all, have we done enough education? Have we told the mercury story enough?
I would say no. And part of the reason is that people don't want to hear. So it's not, the knowledge is out there, but unless you're willing to listen to it, you will not look for it. Even among groups that are considered to be illiterate or lack formal education, they are aware of the health implications and the dangers of dealing with mercury. They know it. You can say that the general level of the true magnitude is low. So in the documentary, people are referring to coughs and things like that, which I would attribute more to dust and maybe particulate matter from smoke and so forth. Because the real implications of mercury on the environment and our health are unseen. Because these effects are at the level of the cell.
Okay.
So it's not as if you're going to get sores on your body or your hair is going to fall out. Or
so
something.
physically, I mean, it will not show?
You will not show initially. Later on, when you have higher accumulations, we have what is known as the Minamata disease, where you have tremors and your body shakes, you have pains in the joints and so on. But even before you get to that stage, you have impacts on your liver, on your kidney, as was alluded to just now, that people have to be on dialysis. But it also affects the reproductive system.
Okay.
In that women are now infertile, men are sterile. Even when this does not take place, the possibility of birth defects or spontaneous abortion is much higher. And these, unfortunately, we tend to attribute to spiritual rather than physical causes. But the real problem with mercury is that as an environmental toxin, it does two things. We have a process of what known as bioaccumulation, and we have biomagnification. The first, bioaccumulation, is as you take in mercury, it gets trapped in the fat in your body. You excrete some, but not all. So you eat little by little, and it concentrates. The biomagnification aspect of it is that as you go up the food chain, you may have a very small quantity in the water, algae, zooplankton that our fish are eating. Then it gets higher. The small fish is eaten by a bigger fish, and then it keeps on accumulating in each one, but magnifying, because each one absorbs what the previous one has taken. So in some way, it's like the reverse of the men's gold issue, where you actually do have the accumulation. We have mercury now as a global problem. It's everywhere. So we cannot just assume that it is the small scale miner, and I'm saying small scale as opposed to illegal. Small scale, the artisanal small scale miner who is going to suffer the effects. Because once mercury is brought in, and it is a regulated substance, you cannot just bring in mercury. A lot of it is smuggled. So there are other implications on corruption, on value chain distortion and so on, which comes in when you are bringing in an illegal substance.
But can we be clear, mercury, the use of mercury is legal in Ghana, is it?
It is legal in so much as it is done under specific conditions.
Okay.
And unfortunately, the conditions are not being used. So what they have now is a series of education measures for the miners on mercury-free mining, because you can do it without mercury.
So first of all, the reason mercury is used is because it's used to separate the gold from other materials.
The process is called amalgamation. So what happens is that mercury sort of attracts the gold particles to itself. It forms an amalgam, the sort of thing they use for your tooth. They say, before they start using porcelain. And that amalgam needs to be heated, which drives off the mercury and leaves the gold behind.
Okay.
So the mercury acts almost like a sponge, sucking up the gold particles, combining it into a new substance, and that is what you need to burn off. And unfortunately, the way they do it is they put the amalgam on a shovel, then put it over a coal pot. So all those vapors go into the air and go into the system. So we have systems where they use retorts. These are like closed systems. And even in those systems, you can then recover the mercury. A side issue is that because they don't know how rich the ore is, they don't know exactly how much mercury to add.
Okay.
So they tend to add excess mercury, then they squeeze it out. So that's another source of contamination before even they burn what is the residue. Because if there's nothing for the mercury to amalgate with, it will just stay in its free state.
Okay. Prof, let's bring back Seth Kwame Boateng. Apologies, Seth, the Skype was not too clear. Hopefully we have a better connection this time around. You're telling us about how you zeroed in on the effects of mercury. Let's conclude that.
So when I visited the Cape Coast Teaching Hospital, I saw a number of patients who had come to the dialysis unit for dialysis, and most of them were coming from the mining areas, and they needed approximately 200 cedis per session. They were supposed to have 3 sessions in a week, so approximately 600 cedis. Most of them were poor or are poor. They can't afford, so they die. It is a serious problem also because of how it affects you and I, those of us not living in the mining areas, but also suffering from what is happening there. Remember, you eat fish from the western or central regions, right? You also eat food from there. Most of these have been contaminated, and Prof will tell you, we consume them. The effect we will not feel now. We should give ourselves a few years to come. So I realized that we were all at risk, and we needed to do something to help educate people on this problem, and also to let the illegal miners know that what they were doing was dangerous, even though most of them had been sent to the School of Mines in Takwa for training. Yes, I went there and I met a number of them. Some of them were apologetic. They were like, if they knew that what they were doing could have serious effects on them, they wouldn't have tried. So that was the problem, and that was why I needed to investigate. And I'm grateful to Professor Craig Gordon for assisting me put this documentary together, and all the other doctors, researchers in Cape Coast and Western regions that I needed to follow.
So, Seth, those who are still engaged in mining, the small-scale mining, did they appreciate the stories being told by these other persons who had been affected?
In fact, most of them didn't know that they were sick because they had inhaled mercury. Those I interacted with felt they had been cursed. That was why they had been coughing for years. That was why a number of them had died in the past. In the few clips that we showed, I went to Port Dumpton in the Western region. And when I went there, in the last few years, approximately 40 people, young guys, have died. So they thought somebody had cursed them. They didn't know it was mercury poisoning. So now they really appreciate this. As to whether they will still learn from this is another issue, because they are going for gold and they don't get the consequences. So it's one thing telling the story and one thing getting them appreciated. I think ultimately we should be targeting those authorities as to what can be done to, yes, we have placed a ban on mercury use, but it's still in the country. So what more can we do to ensure that people really stay out of mercury? It's a serious thing. I've done documentaries, but I've never felt this sad, and I've never felt this. I felt uneasy. You understand? Because
I do.
I dread the impact on us, those of us outside the mining areas who would have to suffer this.
Let me bring in Prof. Seth is talking about the effect of this, and some people not even knowing that it's the effects of mercury. That's why they're breaking down. Do we have any kind of data? Are we doing any kind of research?
Actually, there's a lot of research. If you go through the literature, I would say in the past 10 years or so, There have been studies on women, studies on the miners themselves, studies on food. We even have studies done by a group working out of KNUST who are looking at mercury in wildlife, specifically birds along the Lake Volta. And again, they found elevated amounts of mercury in the birds. Obviously, they're eating fish that was contaminated. But I would like to stress this point that Seth has just mentioned, the fact that once mercury is in the system, it has no boundaries. As I said, a bird on the Lake Volta has mercury in it. When that bird dies there, it is going to decompose and release that mercury at that spot. So it's being carried. The fish that we collect in the sea, which is contaminated with mercury because the mercury in the rivers goes out into the sea, is then caught at the Western region, processed and brought to Accra.
That's scary.
Yes, it is.
What kind of quantity is dangerous?
That depends on a number of factors, because the form of mercury also impacts its toxicity. The one which is most dangerous is methyl mercury. It's basically an organic metal complex. It's organic material linked with the metal. And I think the WHO is, I think it's 5 nanograms per gram of tissue. So effectively, you're talking about a drop of mercury in a large swimming pool.
Oh, okay.
Very, very small. Very, very, very small. And as I said, it accumulates. So in some countries, they actually have recommended annual dose. So if you know your fish is contaminated, you can eat 2 fish a year.
Okay.
Don't eat more than that, because then you'll exceed what your body can excrete. Because they have indigenous populations in Canada and so forth who depend on seafood for their livelihood. And if you tell them you can't eat the fish at all, there's a problem.
I'll come back and ask how we process fish in particular, so that can we be helped through?
It will not change anything. The
Really?
mercury is bound to the tissue.
Wow.
It is bound to the tissue. You're worried.
Do we? Yeah, I am, and I'm thinking.
You eat a lot of fish.
You know how we regulate these things? How we don't check properly. So who is regulating this sector? Are we sure they're doing the right thing?
Well, the fact of the matter is that, and I actually always like to go back to the basics. You have regulations when there's a breakdown in the system. And the breakdown in the system for me here is the fact that our behavior and our attitudes to the environment have been totally messed up. If we respected the environment, we would not use mercury the way we would do so. Therefore, we wouldn't need a regulator. The problem with regulators, laws, and things is that in our peculiar context that we operate, people are happy when regulations and laws are created, because that gives opportunity for, let's say, wealth redistribution. I'll use that, what do you call it, terminology. So I won't be accused of anything. The fact that we know it is wrong, the fact that we know that people are getting it, we don't produce mercury in this country. It has to come from outside the country. It crosses our borders, it crosses our ports. So when you're looking at who should regulate, basically it's everybody. It's everybody. And we know that if somebody is producing, or a region is producing X amount of gold, and they have no other process in that community for gold processing, then they must be using mercury. There are other methods, yes. But if we know that they don't have it, that means they're using mercury.
Let me wrap up with you, said Kwame Boateng. So this documentary shows later today. What should viewers expect? What do you want them to take away from that documentary?
Marvin, let me make you more uneasy. One researcher who is in this documentary, he is at the Kofono Teaching Hospital, and they have been working on mining areas. Their studies showed that most children, being born in those areas, are coming up with cleft. So they are getting most of their cleft cases from the mining areas. Tells how dangerous it is. And they are getting worse cases. When they come, the parent, the mother, was once involved in illegal mining. You understand? Even when she was pregnant, she was still involved. So the babies end up suffering these effects. I want Ghanaians all over the world to appreciate why we must all be involved and put a stop to mercury. And also, I am so happy that as a country, we are regulating small-scale mining. At least those who benefited from the training school in the Western region from Sakwa University, they appreciate why they must not use mercury. But I wonder, just a few of them had this training. So what happens to the thousands out there who have no idea what they must do? That's my worry. So I really want Ghanaians to watch this documentary and see the need to join the crusade to ensure that put ban on mercury, and also we get authorities to really act well so that we can save our lives. First year you will not feel anything. Second year, nothing. Third year, still feeling the effect. And we are all at risk. It's a ticking bomb, I must say.
Okay. Seth, we'll have to leave it here. Thank you very much. My colleague Seth Kwame Boateng, producer of The Mercury Effect, joining us from the UK, his new base. But Prof is here in the studio. Prof, I want us to wrap up. And why is it important that we tell the story the way we've chosen to tell, and airs later this evening at 8:30? Why is it important?
Well, I think the role of media is always to highlight and to educate, communicate. I would say the entertainment for me should be last. And I'm saying this again in the context of a document that has been produced by the EPA, which is basically a plan and the Minamata agreement that we have signed, I believe. And it has 5 priorities in it. One is to develop the legal framework. The second is to phase out mercury from the health sector. So mercury in thermometers, mercury in medication. Reduce where feasible, eliminate the use of mercury and mercury compounds in artisanal small-scale mining. Reduce the emissions and release of mercury from point sources. And the 5th priority is to manage mercury waste in a sound manner.
Okay.
So I would like to just point out that, yes, it is true that most of the mercury that is entering our environment comes from mining. But we also have mercury in skin bleaching products. We have mercury which is coming when we burn waste as open burning. So there are a number of sources of mercury, and we have to consider them all, and we look to the media to keep on raising attention about this scourge so our children will have a better future.
Okay. Professor Chris Gordon, thank you so much for your time. And you have to make time to watch the documentary at 8:30 p.m. today. Becky's coming up. Ketsi Awake Purified Drinking Water with some show business.
miners use mercury as a way of extracting gold.
The mercury eventually will catch up on us.
Everybody's at risk.
The Mercury Effect, showing 8:30 p.m. Monday, 21st January, and 6:30 p.m. Tuesday, 22nd January. The Mercury Effect.